When disaster strikes, food and water alone aren't enough to ensure your health if you are dependent on daily medications. But stockpiling your personal meds is difficult when most insurance companies will only allow a 30-day supply. So you'll need a plan.
So the idea would be to get your prescription refilled at the earliest possible date for several months, and you can kind of scooch ahead just a little bit, getting a few more tablets each month.
Beverly Schaefer is the pharmacist and owner at Caterman's Pharmacy Sandpoint. She says once you start your collection of extra pills, don't just throw them in the disaster kit and forget about them. Remember, all medications have an expiration.
So the trick is, every year on your birthday, you replace the supply. You take out your stash and put new pills in and use up those pills that have been in that supply for a year.
It's also important to check your prescription plan. Some insurance companies will allow for a 1-month vacation supply.
And this isn't exactly vacation, but it would be something that if you can get a 1-month vacation supply, that would certainly, meet the needs of having an extra month's worth of medication available.
Otherwise, the cost for an extra prescription comes out of the patient's pocket.
Some of these drugs are pretty expensive. Some of them require special storage.
And while some people might try to conserve their medications, Schaefer says skipping pills is never an option.
You wouldn't want to try to stretch, your 5 pills into a month's supply by taking it every 2 or 3 days. You really would want to have at least a 2-week supply of medication.
Schaefer says the need for extra meds doesn't always have to come with a disaster. She's seen medication shortages happen frequently during snowstorms and serious windstorms, highlighting the need to always have extra medication on hand. For HealthLink, I'm Amity Addrisi.